let me just say that you can do all the right things, but if people don't know what you're doing, if they don't know the value of hiring a veteran, you don't have the impact that these men and women deserve. Last year, Fortune put a veteran on the cover of the magazine. I'm especially glad there was a woman veteran, and it says, "The new face of business leadership in America." Forbes and Business Week are picking up this trend. They've all had articles. 2 weeks ago in Business Week, there was a tremendous section called Ready, Aim, Hire. And on Veterans Day, the Entertainment Industry Foundation is doing a live 2-hour uninterrupted broadcast on the value of hiring veterans and on military families that will involve, household name stars, actors, actresses, musicians. So there's a movement, there's a new era in veterans employment beginning. We appreciate your interest. We're thrilled and honored to partner with you in it. I ask that you engage with our state directors at the local level to loop you in and connect you with our employment representatives. I ask that your organizations connect with the mega hiring fairs which are taking place. My staff is at your service to support you in your needs. The HR toolkit for employers should be done by Veterans Day this year. We're thrilled to be here at the summit. I apologize for needing to catch a train to New York, but we have 1,000 veterans needing a new journey in their life, and we're committed to helping them get that, several hundreds of them tomorrow. Thank you very much.
Secretary, I appreciate the remarks and the enthusiasm, probably more than anything else. And I think what you'll find from us is a commitment, given our communications with healthcare companies and some of the things we're doing on the web, is to share your information. As you say, probably the most difficult thing is once it's created to have someone figure out it's there and how to access it. So we will work closely with you, with our team, to make that information available through whatever resources we have so that we can tap into your folks to make this happen. I do appreciate it.
And if there's one individual that we could follow up with, if you could let me know who that is, I would like to push some of this information to you so you can disseminate it to the organization. That way we can make sure folks know about the dates of the 100 hiring fairs, the websites for the employment representatives as well.
We will follow up. We'll get you the names, and we'll make sure that we publicize everything that you ask us to. So we appreciate your help and your support, and good luck in New York tomorrow.
All right. Thank you, sir. Thank you, gentlemen, ladies. Thank you so much.
Why don't we, again, we tried to break this up into 3 different topics. So before we move on to the next one, just on any comments from those of you at the table or otherwise, just on some of the things that we've been talking about in terms of really hiring and finding veterans to hire. So let me open it up before we move on. Comments or thoughts from anyone else around the table? None?
I'll speak up. This is my name is Ray Thomas. I am Regional Director of Community Relations and Urban Marketing for Aetna. And one of the things that we just recently became involved with was an online virtual recruitment fair sponsored by Millicruit and the Military Officers Association of America. And that was the first time we as an organization had done that in a virtual sense for at any time. And the statistics that came out of that were 18,000 veterans and or current soldiers in 42 states and 6 countries around the world participated in this online virtual fair. So we had an opportunity to have more of our executive recruiters available to talk to these folks than we would at any kind of standard in-person type of affair. We had 650 people that specifically talked to Aetna during that day, and 100 of those folks that we did speak to ended up applying for positions within Aetna. So this is an opportunity, I think, if folks have not done that in the past, past, and again, this was the first time for us as a corporation. So I think finding ways to reach out to people at these fairs that aren't necessarily in person, we would never have an opportunity at an in-person fair to reach and touch that many people. So I think finding ways to utilize cyberspace, to utilize online, to utilize virtual opportunities to do that, I think is going to be something all of us can utilize in the future.
Thank you. One of the things we'd like to do as we go through the session is to really aggregate the information that we're getting from you or from the Secretary, and then be able to post that information and share it. So as you hear of things or as you know of things, we would very much like to create a role of somewhat of a conduit there so that we can share the information and make it available, whether it's through the Department of Labor websites or through the Hero Health Hire website, to make sure that people have access to this. And one of the advantages of getting a room with as many people and from as disparate places as we all are is to be able to share experiences and then create an area where everyone can see it. So I very much appreciate your help, and I know that Aetna has done quite a bit in this area, and it's been great. So thank you very much. Other comments, David?
I'm sitting here thinking about an initiative that we started a few months ago as our owners dedicated $1 million to outreach on employment in their market space, basically to use the platform of pro sports teams to do that. And I'm thinking about the fact that we're doing that singularly. We've created the nodes, but Renee, if we could, what I'd like to do is to make sure that as we do that in each of those cities, that we might connect with the healthcare employers that are interested in establishing those interconnections with the military community in those markets, with those pro sports teams, and to devise a strategy that would result in the public service announcements that follow that for perpetuity in those sporting arenas, that the Hire Hero Health piece would be a part of that.
That would be great. And the other thing, just to keep in mind, we have a lot, healthcare is a very broad industry. It's not just about health insurance or health, but it's also about health delivery. It's about pharmaceutical manufacturers, and the level of experience and needs vary fairly dramatically from the different constituents in that industry. So we have representatives from many of those areas at the table. We need more. I know Marty Gavin, who runs the Children's Hospital in Hartford, is here. But our goal is that the needs of a hospital may be different than the needs of a health insurance plan or others. And the goal is really to create opportunities and choices for veterans. It's all about choices, and it's all about learning and training. And I think as we grow and share the information and ways to disseminate it, it really is to do it in a way that's universal throughout healthcare. Because as the Secretary talked about in terms of 4 million new jobs being created in healthcare, it's in all aspects of healthcare, whether it's devices or insurance or direct care delivery. It's all of those areas that we need to bring together and move them forward. So it's very helpful as we look around the room to see that we have that representation. And any other comments on this area? Governor?
I just wanted to share one practice that some of you may want to engage in. There is a certain reality that there are people who are more inclined to hire veterans. They're veterans. And when you go back to your operations, those of you who aren't from the HR or talent acquisition side, do a survey and see what percentage of your people in HR or talent acquisition are actually veterans. And if it's particularly low, it will not surprise you that your hiring of veterans may be low as well. One of the things that we have alerted ourselves to is that simple fact. We need to have more veterans in our HR functions, in government, and in the private sector. And so I offer that, since the first section was on how to recruit. Well, make sure your recruiters represent veterans.
My name is Dr. Scroggs. I'm with ValueOptions and on the Board of Governors with the National Military Family Association. We have the great pleasure to be the behavioral health subcontractor for Humana Military in the TRICARE South region, but I'm a retired veteran, and one of the things that we've been focusing at least the last couple of years that I think is very important for this audience, we've worked with the VA on outreach to our EAP and work life commercial companies, HR executives, as well as CEOs and others in leaderships of Fortune 500 companies across the nation. And one of the things that is so clear is many of those HR specialists have really extensive, or maybe it goes along a unidimensional curve on their degree of sophistication in dealing with their wounded warriors, their National Guard and reservists who are deploying in and out of their job space. And quite impressed with the growth of those programs in a lot of these companies. But the one thing that we have found in each of our webinar sessions is the invisibility of their employees, of the spouse that is back and left behind, that is having to juggle all those crystal balls, keeping everything in place, but many times are in these very rural areas where the spouse doesn't want to say to the community, hey, guess what? I'm going to be here with the 2 little kids for the last 18 months or next 15 months by myself. And so they're isolated. So, I had all these HR folks suddenly saying, my gosh, I don't know how many of my 500 or 1,000 or 4,000 employees are in these categories. And, there's privacy issues and concerns, but they started finding uniques. So it's just a point that I think is very, it's easy to focus on just the service member, but if you want to throw a wrench into the reintegration of that returning warrior, let that spouse get fired because she's late or he's late, or their performance starts dropping down, and it's just a big piece of the puzzle. So just a point I'd like to share.
Thank you. I think that's absolutely right. I mean, part of the issue is not only when the veterans come back, but when their families are here on their own, struggling and having unique issues, many of them behavioral health, but not only behavioral health, they're really coping and stress issues, that we'd be sensitive to their needs as well. I appreciate that comment. That's great. Let's move on to the second topic, which really relates to challenges faced by veterans entering the workforce and the consideration for those employees. And let me ask Pam Hyde, who's the administrator for SAMHSA from the U.S. Department of Health and Human Services, to make some comments. Thanks, Pam.
Thank you, Dr. Lair. I'm really pleased to be here. I bring you greetings from Secretary Sebelius, who asked me to convey to you the thanks to Magellan and all of you here who are participating in this summit. It's great to see the interest and commitment of all of you. I think this year the President and the First Lady and Dr. Biden released a report called Strengthening Our Military Families, Meeting America's Commitment. There were 16 cabinet secretaries that were involved in this effort, and out of that came 50 commitments from federal agencies across government, federal government. There were 4 strategic priorities there. The first one was about the psychological health of military families. And this report does deal with, and you'll hear this as I talk about this just a little bit, not only military personnel, deployed, veterans, reserve, Guard, but also their families. And the second major initiative is around military children's education, which is a real challenge as children move around, especially for those who are deployed. Developing career and educational opportunities for military spouses, and then finally increasing child care availability and quality for people in the armed forces. Those are the 4 goal areas. I want to highlight just a few of the areas that HHS is involved with, and you'll see the interagency connection here, and then talk a little bit about the behavioral health challenges and some ways in which I think employers can help address that. So the report had several opportunities, one of which was Department of Defense and HHS have come together to try to improve community mental health services available for military families, and also specifically to focus on suicide. HHS, the Veterans Administration, HUD, and DOL are working on homeless veterans issues, and HUD may speak about that. HHS through HRSA has emphasized increasing access for veterans in rural hospitals, especially where there's not a veterans facility close by. And HHS and DOD and the Veterans Administration are also working to try to incorporate curriculum about military culture into professional associations' curriculum as they train people. One of the things that we realize is that the health and behavioral health fields don't know about military culture, and that may be an issue for employers as well as you're hiring individuals.